Assessing firing patterns or muscle activation sequences, again in a functional assessment mode, helps us identify how the body is operating as a unit. This is an example of assessing for core function, obliques and transverse abdominis. This client is activating rectus abdominis first, which is out of sequence. We ask him to draw in and lift, and we are feeling rectus abdominis first. We should be feeling more of the obliques and transverse abdominis. The next assessment is for knee extension. The pattern should be vastus medialis, then lateralis. Assessing for the firing pattern for knee flexion involves placing the hands on the hamstrings and the calf gastrocnemius area. Hamstrings should contract first. Our model is activating the gastrocnemius first. This is inappropriate. Hamstring, not gastrocnemius, should contract first. Placing your hands as demonstrated, have the patient flex their knee and palpate for which contracts first. To assess for hip extension, demonstrate to the client how you want them to move. Then, palpate at the hamstrings, the gluteus maximus, and the opposite low back area. The hamstrings and gluteus maximus should contract first. Which they do. There should not be any activation in the low back area until the leg is above 15 degrees. The firing pattern sequence for hip abduction should be gluteus medius, fascia lata at the same time, but not up into the lumbar area. Place the palpating hands in the proper locations and activate the muscle. During palpation, it is identified that the fascia lata muscle is activating first. To correct, apply inhibitory pressure to the belly of the muscle and have the person move the leg. In essence, you're not allowing the muscle to contract. This will encourage the appropriate activation sequence. Then reassess. With the client seated, to assess for movement at the shoulder, we place our hands as demonstrated, show the client how we want them to move, palpate, and the upper trapezius area should not move first. And in this client, it does. Correction will be to inhibit the upper trapezius area while the patient moves through the range. And then reassess.